Hi, everyone. It is 12 o'clock Eastern Time, so we will go ahead and get started with today's session. Thanks so much for coming to Health Statistics on the Web. My name is Erin Seeger. I am the Health Professions Coordinator for the network of the National Library of Medicine Middle Atlantic region, and I'm looking forward to spending the next hour or so with all of you. A couple housekeeping items before we get started. Closed captioning is available through the link in the chat box. We will record this session and post it on the NNLM YouTube channel in a few weeks. I will answer questions at the end of the session, so feel free to type them into the chat box anytime throughout, and I'll circle back to them at the end. And make sure that you chat your question to all participants. This session is eligible for both MLA-CE and Nchs CECH, and you can claim that through the evaluation link at the end of class. It will automatically open up into a window when you exit out of the session today, and we'll also provide you the link in the chat box after the presentation. All right, let's go ahead and get started. One thing I like to just let everybody know about, in case this is your first session with NNLM, is a little bit about who we are. To give you a brief overview, NNLM is a program coordinated by the National Library of Medicine to ensure that health professionals and the public have equal access to health information. We support member organizations in our respective regions through training, funding, and resources. And an organization would be a potential NNLM member if they provide health information to the public. This means that our members are a really wide range of organizations, from health sciences libraries and public libraries to hospitals and public health departments. And if you want to learn more about NNLM as a whole outside of just health statistics on the web, you can check out our website at nnlm.gov. So you can see our course objectives for the next hour today. We're going to be focusing solely on finding health statistics that already exist on the internet somewhere. So despite the title of our session containing the word statistics, we're not doing math, and we're not talking the calculation of statistics for research or anything like that. We're focusing on finding and selecting statistics that you can use for free from different surveys and things like that. So here is our agenda for the session today. We'll talk a little bit about just an overview of statistics and their use. We'll talk about some steps to finding health statistics or formulating the statistics type research question. And then we will also look at some different sources of health statistics. I think that a good way to start talking about statistics is to define what they are and what they are not. And you can see descriptions here of data, data sets, and statistics. And data is the raw numbers or individual counts of something happening. A data set is when the data has been arranged in a logical way, and statistics is when the data has been analyzed or summarized in a way that is easier for someone to understand. And this could be through a percentage, creating a graph, or showing the information on a map. I think that a lot of the health information that we see regularly reported is already in the statistic form. And today we'll focus primarily on where you can locate those statistics. So a textbook definition of health statistics is numerical data that characterize the health of a population and the influences that affect its health. And this definition quickly summarizes many key features of health statistics. They are population-based, and they measure a wide range of health indicators for a community. And a community could be the whole U.S., it could be a region, a city, a county, state, zip code, etc. And the statistics could be a number of things. It could be something like birth or death rate, disease prevalence, or other influences like education or income. And they're usually collected over a specified period of time. And while there are many important uses of health statistics, which we'll discuss in the next slide, it's good to remember that health statistics are collected to meet the needs of the collector. And this means that they can be influenced by an organization's perspective or bias, which could affect the collection device or the outcomes that are reported or what data is collected to begin with. So when possible, it's a good idea to read the notes describing the reasons for and the methods of data collection. It's also worth noting that some information is collected in more than one survey, and estimates of the same statistic might vary between these surveys. An example is there's 4 surveys: the National Health Interview Survey, the National Survey on Drug Use and Health, the Monitoring Our Future Survey, and the Youth Risk Behavior Survey. And these all measure cigarette use, but estimates of cigarette use differ between them because of the different methodologies and sampling frames or questionnaires or definitions that are used. So some uses of health statistics. You can see some of them listed here. The first is to provide information about the health of a population and what influences their health. And while statistics are population-based, they can help an individual understand where they fit within the bigger context of their community. And they can help us understand differences between those subgroups in a community as well. For example, health disparities are a really commonly discussed and important public health topic. And in a nutshell, these are differences in health outcomes that exist between different racial, ethnic, socioeconomic groups in the United States. And health statistics can help us understand these differences, which I think then can help us think about how we can make outcomes more equal. Health statistics also guide policy and program development, and this could potentially be the need for creating a new policy or evaluating and revising an existing one. And statistics similarly influence the development of public health programs by supporting the need for an organization to receive program funding, helping someone understand if a program is improving health, or helping them decide what type of program is needed to begin with. So let's talk a little bit about finding those statistics that you might need for all of those purposes that we just chatted about on the previous slide. You can see here an easy process to consider when you need a health statistic. The first thing to do is formulate a question. And you may want to consider the time frame, geography, or age range that you need the statistic for. A few examples of your question might be something like, what percentage of those 18 and over reported being a current smoker in the state of Virginia in 2017? Or what percent of families live below the federal poverty line in Allegheny County in 2018? Then choose the best resource to answer the question. You may want to consider different portals, federal agencies, or state and local organizations that you think might have the statistic. And I hope that I'll give you a few starting points in our presentation today. There's also a handout for the class. We'll post a link to that in the chat box, and that kind of sorts out and reminds you of the sources that we're going to discuss today. Then, once you've done your search and you've decided what source to look at and you've looked at the information there, you can evaluate what you found. Is there a need to look for a better quality source, or is this one sufficient to answer your question? And then repeat as needed for additional information or for a different question. So I'm going to move on to looking at different places that you could go to locate health statistics. And the first type of resource that we'll look at is a couple of portals. And by portals, I mean kind of websites that you can go to that list out different sources or categorize a lot of different outside sources for you. The first of those portals is called PH Partners. And this is short for Partners in Information Access for the Public Health Workforce. It's a collection of different partners such as the National Library of Medicine, Centers for Disease Control and Prevention, Agency for Healthcare Research and Quality, American Public Health Association, and several others. And the goals of PH Partners include encouraging collaboration between the partners themselves and between the public health workforce and librarians to deliver resources to the public health workforce. And there's a lot of different topic pages on the PH Partners website, including those for bioterrorism, HIV/AIDS, nutrition and workforce development, etc. And there's also a topic page on data and statistics that categorizes sources of data and statistics by the geographic area they cover or kind of by the topic, depending, and includes information about training and education related to data and statistics as well. So I'm going to go ahead and open up that page, and we'll look at a couple examples of how you could search on PH Partners. So I'm at the main page right now, and I'm going to just use this Health Data, Tools, and Statistics section today. And you can see there's all of those headings here for different types of data. And for example, if I was interested in something at the state level, I could open up this state health data section, and then I can see several different types of reports or websites that collect this type of information. And of course, there's no way I can show you all of these today, so I encourage you to circle back at some point and explore what's available to you here. As an example, if I thought health equity state snapshots was what I was interested in, I could open that up, and it takes me to the Association of State and Territorial Health Officials. And they're telling us then that this is from a 2014 Health Equity Minority Health Survey. And for each state, you could click to open up the report about that. I'm going to close the state dropdown, and there's a huge number of county and local resources here as well. So for example, if I open this up and thought I might need to use the Atlas of Rural and Small Town America, you can see that that's from the USDA. And you can see they explain right here that it's statistics by categories of different socioeconomic factors like people, jobs, income. And as I scroll down, then you could enter the map, and they're telling you what date the map is updated through, and then you could enter it to look at the data and statistics right there. And pretty recently added here was this section on COVID-19 statistical data. So if that's something that you are looking for, you can see that there's several links here as well. So that's definitely, I think, a portal that's worth circling back to for health data and statistics, but also just for other topics, for those other topic pages. But we'll go ahead and look at our next resource for today, which is the National Center for Health Statistics. And this is the nation's principal health statistics agency. It has been part of the CDC since 1987. And NCHS compiles health statistics to help guide decisions about things like policy initiatives, the healthcare system, and health disparities. And before I open up the NCHS page, I want to mention that I indicated on each of these slides where you could find the link to these other sites using PH Partners. So I mentioned there's a lot categorized there. So what I'm telling you on this slide is that NCHS would be linked within PH Partners under that National Health Data dropdown, and you'll see those little yellow plus signs as we move forward. So that's why I suggest circling back to PH Partners, because everything that we talk about today is most likely listed in there. But let's go ahead and open up the NCHS homepage and see what's available. And something that I think is helpful to look at here is descriptions of the different surveys that they conduct. And so you could click population surveys, and then you see their surveys and data collection systems, and they give you a description here of the data source and methods for each one, as well as the selected data items. So you get an idea of what type of information you would find. And our focus today is not data heavy, but they do have a section here for data access, data and tools, if you're looking more for those like raw data as opposed to the calculated statistics. So there's a couple ways to find quick and easy statistics on NCHS. And one of those is in the data briefs. So you can find that under publications, and then by selecting data briefs. And these are kind of short reports that are giving you statistics from those surveys that we just looked at a moment ago. And you can see there's different drop downs for topics or years or which data collection system you're looking for. So for example, if I was interested in activities of daily living, I've now filtered it to that, and I can see the most recent data brief and what it was titled and what data collection system it was pulled from. And when I open that up, then you can see that as I scroll down, there's some key findings that contain some statistics, and then there's things like charts and graphs that explain some key statistics about that topic. You can also search for something from the NCHS homepage that is called Fast Stats, and you can find that under Topics, and then I just select this main Fast Stats heading, and you can see it's explaining to you what this is, selected statistics on a variety of topics, and other resources and tools, and it's organized alphabetically. So perhaps if I was interested in asthma, I can open that up and I can find things like the morbidity or physician office visits, and they're telling us this is national, so this is for the whole U.S. And down at the bottom, there's related fast stats as well as more data links to that topic. So it's a good starting off point. And I mentioned you could look at those population surveys when we first got to this page. And something else I like to share is that under Data and Tools and Data Access, you can open up this resource guide. And you can see here that this is kind of a PDF that opens up that will explain to you their kind of key data sources, the major NCH data sources, and we'll describe them and give you the link for each of those specific surveys or sources. So that's kind of a nice resource to refer back to. All right, so we're going to move on, but again, just like the first portal, PH Partners, there's a lot to explore, so it's a good one to circle back to. Another way to access statistics specific to a health topic is through Medlineplus. And for those of you not familiar with Medlineplus, it is the National Library of Medicine's main consumer health information portal. And Medlineplus has information on over 1,000 health topics, drugs, supplements, and is intended for the general public to access trusted health information. And you might be wondering then why I'm bringing this up in a session about finding health statistics. Well, the topic pages in Medlineplus will also link you to statistics on your particular topic of interest. So I'm going to open this up and show you those topic pages. So this is the Medlineplus homepage. There's a ton of health information that you can look for. And you can see here health topics, and then you get a big list of different categories. Perhaps I'm interested in diabetes. I'll open that up, and then you can see this list of all of the diabetes topic pages that are available in Medlineplus. So they have them specific for diabetic kidney problems, diabetes 1, 2. I'm just going to choose the one that's called just diabetes. And you can see there's a kind of, I think of this top box as like a table of contents to the page. And you can see there's a lot of health maybe non-statistical information here. But down under research, under statistics and research, you can see that there's several different statistics resources here. So for example, this Diabetes Interactive Atlas is from the CDC. And so it will take you right there where you could start then looking for statistics on that particular topic. There's also a link to FastStats, which we just looked at through the National Center for Health Statistics, and some other resources that you could check out. So even though the primary purpose of Medlineplus is to get high quality health information out there to the public, I also think it's a good starting off point if you're not sure about maybe some places that might have statistics on that topic. Something else to consider is that some health departments have their own section of data and statistics. So like this example that you see from the Wisconsin Department of Health Services. And you can also find different reports or things from different health departments. So this is a Louisiana health report card from 2017. And then same thing for the health departments, you know, for a county or even for a bigger metropolitan area, like this report from the Healthy Chicago Community Health Assessment. So even though that will be more specific to your region, so we won't demo any of those state-specific resources, it's a good resource to keep in mind. And you can find links to some of those local data resources on PH Partners. There's a drop-down that's called Individual State and Metropolitan Data, and that will kind of list out you know, some different links for you to check out based on where you live or where you're interested in getting data for. So I'm going to move away from some of those resources that are kind of the portals that have a lot of different things in there and focus on a few resources where you can find national statistics. And most of these ones in the national category will go to the state level as well, so you can compare national to state. So the first one is the Behavioral Risk Factor Surveillance System, or BRFSS for short. And this is a survey that's sponsored by the CDC and other federal agencies. And the survey collects data from telephone surveys about people's health risk behaviors, chronic conditions, use of preventive services, that type of information. And it's actually the world's largest continuously conducted health survey. Back in 2014, they did 506,000 surveys, which is a pretty big number. And data from the Behavioral Risk Factor Surveillance System is often used to plan different types of health promotion activities. So let's open that one up. This is the main page for BRFSS. And you can see here that there's a lot of different options. Something that I think is useful to look at if you have a specific topic or question that you need is actually this questionnaires. So before you go diving into the data and realize that you couldn't find what you needed, you can see what questions they asked in what year. So this is the questionnaires by year, and you could open it up and see what the survey questions were. And they do something where there's a core set of questions, and then there's these optional state modules. So you could look at that too for if you were looking for what might have been different or asked in your state. But then if you wanted to go ahead and look for different data analysis tools, things like that, you could actually click prevalence data and data analysis tools. And there's several different things here where you could choose, but I'm going to go ahead and choose prevalence and trends data. And then you can see that you're given the option to select your state or a topic to start out with. So you can choose, and I apologize, the way that my screen resolution is sharing, the map of the U.S. is kind of behind some of those other boxes, but I think that's just some of the changes to the resolution I needed to make for the WebEx. It normally doesn't look like that. And we're going to do a little bit of audience participation. So could somebody, if you're interested in having a certain state demoed, could you type that state in the chat box for me? And I'll just take the first one that I see come through. Tennessee. All right. So I'll click Tennessee, and Claire, you gave us Tennessee. So what topic from this list would you like to see for Tennessee? Sorry, it's a little refresh on the page there. I'll open that up again for you. Social determinants of health and health disparities. I don't know that they do that because it's, well, they kind of do that, but it's more about health behaviors. So you'd actually have to kind of see if you'd have to dig around in the data a little bit more. Chronic health indicators. And then which one of these chronic health indicators do you think is interesting? You've got arthritis, asthma, cardiovascular, COPD. COPD, okay. So that's how you could search for your topic. I'm going to choose just the most recent year that they gave me, and I'm going to hit go. Sometimes it just takes a second to pull it up. So what they're telling me they asked was, have you ever been told that you have COPD? And I think it's just taking a second to load. There should be a little bar graph down there, but let's see if it'll refresh. So this is when you select this little chart up at the top, you actually have the percentages of people that said yes and no if they'd ever been told that they have COPD. Let me see if I can get it to flip back to the chart. There we go. So that's usually what it will default to. It was just being a little slow right now. So you can hover over that too to see the yes and no. Have you ever been told that you have COPD? All right. So I'm going to go back to prevalence data, and we'll do one more example here. Could somebody give me another topic from this list that they'd like to see, other than, I guess, COPD, since we just did that one? And I'll just grab the first one I see pop through on my end. E-cigarettes. And there's only one subtopic for that. We'll just look at e-cigarette use. So when I select it from this little box on the right side, instead of narrowing it down to a state like we did with Tennessee right at the beginning, sorry, it's just going a little slow, but it's going to show us the whole U.S. on that indicator. So it's current e-cigarette user, and you can see this kind of lightish green color is the lowest, the lowest percentages, and then the blue, the dark blue, is the highest. So you can kind of see the whole U.S. there, how it compares. And then you could also switch over to this bar graph. And they're telling us that it's the blue is not currently using e-cigarettes, and the red is current e-cigarette user. And when you hover over these little bars, you get the state the state percent, and then you can kind of see how they can compare and back to the U.S. as a whole as well. So I think that's a nice comparison tool. All right. So we're going to move on to our next resource, which is State Health Facts. And this is a statistics resource from the Kaiser Family Foundation. And many of the statistics that you'll find here relate to health insurance and health care, but there's also a pretty big variety. You could also find health indicators like drug abuse, cancer, heart disease, firearms, oral health. And there's also the option to develop customized reports to compare your statistics of interest between states. And I'm going to open up this one. And then you can see that we get actually a pretty similar look to the behavioral risk factor surveillance system, where you can start with a state or you can start with a category, and then there's several subcategories. So for example, my home state is Wisconsin, so if I wanted to know what was going on there, I could open that up. And then perhaps I'm interested in women's health. And then I'm going to select those women who don't have a personal doctor. And you can see now I have a percentage here. And this one is broken down by race and ethnicity, so women who don't have a personal health care doctor. And down at the bottom of the screen, you'll actually see these notes as well, so you can find out where this data came from. So it says among all women ages 18 and over, and this data is actually based on the behavioral risk factor surveillance system. So they're saying that this is from an analysis that they did with a data set from the BRFSS. And actually that brings up a good point of when I said they didn't have a drop down for our other example on the behavioral risk factor surveillance system specific to health disparities, but what state health facts did is they did a little bit of analysis of that data and then broke it out by race and ethnicity, so you might be able to see differences between subgroups. And if you then wanted to add on another state, you can just check the box from that list that's on the left side, and it just added our California on to let us compare between the states. And if we go back to the State Health Facts main page, I won't do an example because it's really similar to the behavioral risk factor surveillance system, so you'll all be able to search pretty easily. But if you wanted to just start out with, you know, a subtopic from one of these, then you could see it for the whole U.S. And back on the main page, I'm going to show you those custom reports, because I think that's a really cool feature. So I'm going to scroll down. There's a little spot at the bottom that says custom state reports. I'm going to refresh this page and see if we can get it to go for us. Because it didn't want to let me click. Let's see if it will go for me. I apologize. It worked yesterday. So I'll give it 1 second and see if it's just loading slowly. But otherwise, I'll just kind of give you a description of what you'd be able to do here since it doesn't want to open up for me. Typically, what you would be able to do here is you'll get a list of those same indicators that are in that we just looked at for the state health facts, and you can select just the ones you're interested in. So if you only wanted alcohol use, you could just select the alcohol use ones. You would hit step 2. It would take you to a spot where you could choose a couple states. So you pick the 2 states you're interested in, you move on, and it loads what looks like an Excel file for you that shows kind of the columns as the states, and then just the indicators you selected as the rows, so you can kind of compare those. So that's definitely one to check out, and you can see one of our participants put the link in there for you if you want to play with that on your own. It is very self-explanatory. I apologize. I'm not sure why it doesn't want to open up for me right now, but it's a cool tool. And we'll move on to some local statistics now. And so these will be, of course, ones that you can kind of narrow down past the state level to like a zip code or a county. The first one I'll talk about is the Census Bureau. And this, I'm sure most of us have heard about. It's part of the U.S. Department of Commerce, and it's the federal government's largest statistical agency. And here you'll find statistics about demographics of people and information about the places they live. And you can locate these by state, county, city, town, zip code, census tract. The statistics you find can be from a number of surveys, so it isn't just the census. That one is conducted every 10 years with a focus on population count. But they also do something like the American Community Survey, which is conducted annually, and that one has a bigger focus on community needs. And so we'll go ahead and open that up. And they did, maybe a year or 2 ago, they started updating their page. So this is at data.census.gov. And something that I think is quick and easy is that you can just start typing in this separate search box for the type of data you want. So, for example, if my statistics question was what % of people in Pittsburgh, that's where I live now, what % of people live below the poverty level, I could start typing Pittsburgh, and you have to spell it right, which I did not. There you go. And you can see it actually populates that bolded item is kind of what they call a like a city profile, so it would give you lots of different statistics for that city. But since my question I know is related to poverty, I'm just going to search those 2 keywords. And now I've been given a lot of different tables, and that's how the census shows you data and statistics is all through a table, different tables with different titles. So you can see under tables, there's several that related to that. There's actually 134. There's also different maps that you could look at, and then other links that or pages that they say relate. I'm going to choose this one at the top that says Explore Data, and it kind of gave me, I'd say, what probably is the general item for what I typed in, which was poverty status in the past 12 months. And so you can see that now I've been given a total for my city, and it's been broken down into a lot of different subcategories by age, sex, race, educational attainment, employment, some others. And as I scroll to the right, now I'm given, that was my total for what I wanted to look for, and then I have the different number below the poverty level, % below the poverty level, based on these specific categories. So really, if I wanted my question to be more specific, I probably should have added an age or a gender or something like that. Or, you know, there's also a total. So, and they give you a margin of error as well. And you could also open up these other tables that you see here if one of them actually looked like a better answer for your question. So I'm going to go back to the main page, and something that's nice about this advanced search is that you can type in a zip code. So if somebody feels comfortable sharing a zip code that they're interested in using for a demo, you can go ahead and type that into the chat box, and we'll use that as a demo. 12866. Great. So I just went to the advanced search. I opened geography. And I'm going to choose, you know what, so I don't have to dig through the list of those, I'm just going to type it in right here. I'm going to choose just this top one, the zip code, that's it's ZCTA, zip code tabulation area. And it's a little bit different. The census has kind of a different way that they look at zip codes compared to the Postal Service. And they have a little video on their website that explains it. I'm not going to go into the details, but I'm just going to choose the top one and know that that's a little bit different than the same zip code that is based on like your mail delivery route, but it's in the same area. And Molly, you gave me that zip code, which when I clicked it, it added it down here as like a filter. And what type of topic are you interested in, Molly, from the ones that you see here? Families. Okay. And it's giving you 3 options. Do you want just families and living arrangements, same-sex couples, or marital status and marital history? First one. Great. So you can see I popped it down there with the zip code tabulation area, and I'm going to hit search. And I'll just choose that top one, the total households. So now you can see information about households by type. So they're giving you options about who lives in that household, married couple, family, or do they have children, or male with no female. So they're giving you lots of different options about who lives there. And then their relationships, that type of thing, grandparents living with their own grandchildren. And as you scroll over, it's similar to our first example, except you can see up at the top we have that zip code tabulation area. And then they're giving you the % that match those categories. There's a lot here. I think those are a couple great ways to get started with searching, but what I will actually talk about is where you can find more info, because I think there's a lot on the census page that we didn't dive into. But what's great is that they actually have a lot of their own trainings. So there's something called the Census Academy, and what I'm showing you is the link to that in the PH Partners website. So when you go to data and statistics like we did earlier and you click training and education, there's lots of different links about training that relate to data and statistics. And so that's one way to get there. You can, of course, just search for the Census Academy on their website, too. And they have their own sets of webinars about their data. They have little short, like 2 to 5 minute videos that are called data gems, which I think is really easy to use. And that's where you could find out more about that zip code tabulation area. They explain that, how they calculate it. They talk about downloading or how to add extra populations and stuff to your tables. So they give you a lot of good training, too, that we won't dive into today, but I hope that's a good start to get going with finding the census data. So the next resource we'll talk about is called County Health Rankings and Roadmaps. And this is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. And their annual rankings provide information at the county level about health outcomes, as well as factors that influence health, like behaviors, quality of life, clinical care, the physical environment. And these rankings show how our health can be influenced by our environment. The website also has, we'll focus mostly on the statistics because of that's what we're talking about today, but I do like to mention that they have other cool kind of like strategies and evidence-informed ideas that can help you to improve what's going on in your area. So those are great things to click through outside of class. But let's look at this. So this is the County Health Rankings main page. It opens up to a map, and just as an example, I'm going to choose a state at random. And I want to point out the difference that they use between health outcomes and health factors. So the green is the health outcomes, and when I click on the little info button, it tells us that this is kind of two measures. It's how long people live and how healthy they feel while they're alive. So those are sort of two broad, what's going on right now, how are people feeling, how long are they living. The blue is the health factors, and that is 4 types of measures. You can see it's health behaviors, clinical care, social and economic, and the physical environment. So I always think of the health factors as potentially there's a lot that goes on, so I guess I can't say always, but the precursor to the health outcomes. Those things are probably going to be correlated. And so that's kind of what they rank. And they rank every state 1 to whatever number of counties that exist in that state on both of these, how they're doing in health outcomes and how they're doing in health factors. And if you wanted to get started exploring these rankings, you could click Explore Health Rankings. And could somebody give me a county that they're interested in seeing demoed for us today? And tell me the state, too, in case there's more than one. Orange, Florida. Oops. There we go. So I selected that. There were several oranges, so it's good that we got the state. And so now we've pulled up Orange County, Florida, and what they're telling us is we have the green again, the health outcomes, and they are number 7 out of a total of 67 counties that are in Florida. So you can see the total up at the top. That's the health outcomes, and below that are the things that go into kind of that health outcomes ranking. And then the blue is the health factors. So Orange has another ranking, and they are 21 out of 67 when it comes to health factors. And you could see those are those behaviors, the food environment, physical activity, the clinical care, social and economic, like unemployment or crime, and the physical environment, air pollution or having a long commute. And they give you the statistics for each of those. And on the left side, you actually can see orange in our list of all the counties in Florida. So if you were wondering, well, what's one ahead of it or one below it? You can see those here. We're looking at overall health outcomes rank, but you could change this list with this little drop down at the top. So you could change it to health factors if you wanted to. And under each of those rankings, then, like I said, you can see the statistic, fair or poor health. When you hover it over it, they tell you kind of how that's defined. So this says it's the percentage of adults that report fair or poor health. And for Orange County, Florida, it's 19%. Some of the statistics also have a little graph to the right. So adult obesity, we have at 25%. And the line in the little graph here is red. That means that over time, this one unfortunately has been getting worse, where a yellow means that it's been staying the same, and a green means that it's getting better. And when you click that, it'll actually open up the true graph of that data. You can also, we're looking just at all the stuff in the county right now. If I click this adult obesity link, then you can see kind of how it compares on a map. So now, though, we're looking not at the overall ranking of the health factors, we're looking at just obesity. And as you could see here when I hover, it tells me the percent for each. And on the left side, it also tells me the top U.S. performers. So when we talked about statistics kind of placing us in context or being able to compare kind of where we are, I think this website's a good example because it's telling us, okay, well, if one county is at 30, the top U.S. performers are at 26. And it also gives us the range in Florida. So the lowest is 19% of adults who are obese, and the highest is 43. And then kind of the average or the overall in Florida is 27. And these little links that you can see here, the data will kind of show you just the same stuff, just not on a map. It'll be listed out for adult obesity. It also gives you a description. So this is things like the measurement strengths and limitations, as well as references. And you can also see the data source, which is the United States Diabetes Surveillance System. So there's a lot more. There's also a little strategies link, so you could click here to go into that. I talked about they have stuff beyond statistics, so you could click for strategies and things like that as well on this particular topic. The last thing I'll show you on here is compare counties. So you can actually look at how two counties compare. And if somebody wants to see an example, if you could give me two counties that you think you'd want to see a comparison between, and tell me the state too, because we have to start with the state here. Hall, okay. And Angela, do you have one that you'd want to compare that one to? Oh, I see. Hall and Lumpkin are two different. I gotcha. I was thinking that was the name of one. So I just put in Hall, Georgia, and then I'm going to go ahead and add another one. So I just search for the state, and then I search for and then the county. And it just auto adds it in when you select the county. So now you have all of those health outcomes and health factors that we looked at on that state profile page when we did Orange, Florida. And you can see all of them here listed kind of in the rows. And then in the columns, you have your two counties. You have Hall and you have Lumpkin. So you can kind of see side by side. You know, for example, fair or poor health, we have 18% in one and 17% in the other. And you can actually add in multiple. You could do 3 or 4, and they'll just keep adding in as more columns. All right. So moving on to the next resource for local information. This is called the City Health Dashboard. And this is a relatively new resource from the Department of Population Health at NYU Langone Health and the Robert F. Wagner School of Public Service at NYU and the National Resource Network. And the dashboard has 36 health indicators for the 500 largest cities in the United States. So some of the indicators can be narrowed down to the zip code or census tract level, others can't, so you just have to check out which one you're interested in. And the indicators are divided out into really similar categories to those used in the health factors section of county health rankings and roadmaps, or those influencer factors. And something I think is interesting and useful about this tool is that they picked the indicators they picked to include because they felt like they were the ones that were the most actionable for somebody who really wanted to work on improving their community's health. So the first time I used this, I was thinking, well, how would you know if certain cities, I don't know offhand every city that's in the top 500 biggest cities. So what I find helpful is I live in Pennsylvania. So when I start typing the name of my state, it actually tells me which cities in my state are included here. So as an example, could somebody give me a city that they're pretty sure are Columbus, Ohio? Great. Thanks, Beth. I'm pretty sure that will be there. So just as an example, I'll start typing Ohio. And Ohio has a lot. And Columbus is there, of course. And now, Beth, which one of these metrics are you interested in? Walkability. That's a cool one. So when we select that, we have Columbus, and up at the top we have our metric details. If you open the drop-down that says more about this metric, you can see the source of it, the year of data collection, and also the data kind of availability level. And it'll also give you different tips and cautions if you're interested in that. And of course it gives us, I guess I should have mentioned that too, it gives us a definition, which is neighborhood amenities accessible by walking as calculated by the Walk Score Index. And when we scroll down a little more, we have this little shaded bar. And over here it's telling us that the yellow bar that's Columbus. That's where Columbus falls on their score, which is 40.5. And then the little blue triangle is the dashboard city average. So it's the average of all those 500 cities that are included in the dashboard. And it's 41.3, so they're really close together. So Columbus is pretty close to that average of the 500 cities. And every indicator is different, so sometimes higher is better, sometimes lower is better. So they're telling you that with this little check mark icon. They're saying for the walkability thing, the index, higher values indicate better outcomes. So you would want it to become more walkable, ideally. And you can scroll down here and you can see a map of Columbus with the different zip code areas it's showing us here, and then the different scores. So you can also kind of compare this one within the city. And some of the metrics here have demographic detail. So I'm going to click that, just this little arrow navigation across the top. And I can't remember if this one does. It's not available for this metric. So I'm going to change it just as an example. Park access will let you look at demographic detail. So now we're at park access, and you can see the total for Columbus. And then when you're at the demographic detail, it has it broken down by race and ethnicity of who has more park access. And very similar to county health rankings and roadmaps, you can compare cities. So I clicked one more over on the little arrow navigation across the top. And then you can see we have Columbus selected, and you could use this drop down to pick another city. And I just picked one at random. And then you can see how they compare on that metric. And now we're still set on park access, so but you could change that too, so you can see how they compare. All right. And something I wanted to mention is that I know some of you might not be in one of the 500 largest cities. So for those of you who are in a less heavily populated area, the Rural Data Explorer might be helpful. This is part of the Rural Health Information Hub, which is funded by the Federal Office of Rural Health Policy to be a national clearinghouse on rural health issues. And they have a data section that contains health statistics that are of interest to those who are living in or working in rural areas. I won't demo this one. It's very easy to search, but you can see you could go to that Rural Health Information Hub page, select Rural Data Visualizations, and then Rural Data Explorer. And then you can, it'll default to this county metropolitan classification. If you want to learn more about that, you can see the source for that is actually the National Center for Health Statistics. You can use this drop down here to look at different metrics that are of interest to rural areas. And you can also narrow it down to a county that you're interested in. And a couple resources I'll mention as we wrap up. If you're interested in doing a little more health statistics exploration after the session today, you could check out this self-paced tutorial called Finding and Using Health Statistics. It's a little bit longer and kind of gives you guidance on digging through some of these websites more, and it's from NLM's National Information Center on Health Services Research and Healthcare Technology. And it's for students, librarians, or other professionals that are interested in health statistics. You can also always check out different texts available in Bookshelf. This is a resource from NLM that provides free online access to books and documents in life sciences and healthcare. And this book that I chose an example discusses understanding risk, not necessarily doing math, but understanding health stats that we see kind of reported in our daily lives. So that's a good further reading if that interests you type of thing. So we're done for today. You can access the handout and the slides for today's session through a link that my colleague Tessa is putting in the chat box. We'll also put the link to the evaluation in the chat box, and it should also automatically open when you exit out of WebEx. And if you have any questions, we have about 3 minutes. I saw one come through earlier, just clarification on how you got to the NCHS data access and resources. So that one, the PDF guide is under data and tools and then data access from the NCHS homepage. And then you just click to open that PDF. And I have about 2 minutes. I didn't see any other questions come through in the session, but if somebody has any right now that I'd be able to answer, I will be happy to take them. Otherwise, complete your evaluation. We always appreciate your feedback, and I'll be closing the session in a couple of minutes. Thanks all for coming. I don't see any questions coming through. Oh, awesome. I'm glad you already were able to update your LibGuide. Non-government authoritative sources that I'd recommend. I think there's a lot out there, although a lot of them, I guess it depends what you're calling government, if you're thinking federal government or if you're thinking local health department. I would check out the sources in PH Partners. I think they link to some non-governmental. It would really depend on what topic you're looking for, because I think, you know, a lot of those that aren't necessarily a you know, national monitoring thing might only be collecting them on a certain topic. So it's hard to say that, yeah, there's definitely one that would have every topic you would need. But I would look at PH Partners for some of those options. International statistics. I know the World Health Organization has a, I can't remember the formal name of it offhand, but they have a like a statistics portal by region, I guess you could say. So I think it's like they have South America and North America, and there's different reports and things you can search from them. So that might be a good one for international statistics. A list of each resource. Yep, there's a handout. There's a link in the chat box to a handout that has the main portal linked on it, as well as the resources, and it kind of gives you a chart of like general idea of what topics are covered on from each website. So you can download that or save it or bookmark it or however you want to do it, and they all should be hyperlinked in there. And the slides also were available in the chat, and they have the URL listed for each source we looked at. All right. So I'm going to go ahead and close the session. There will be a recording of this available in a couple of weeks, and you see my email here. So if there's any follow-up questions that I can help out with, you're welcome to reach out to me.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.